Hello, so today I'm going to talk to you about giardia. So this is another parasite that we can see on fecal exams, but it's a little bit harder to find. It is a protozoan like coccidia, but it is a little bit bigger than coccidia, and it's what's called flagellated. It has essentially, they're not legs, but they look like legs that can propel it through water. The most common way that animals are going to get infected is with contaminated water outside that an animal that's carrying the giardia has pooped in. They drink the water, they get infected with the parasite. It can cause vomiting, it can cause diarrhea, it can cause lethargy. It's not uncommon to see this in puppies, and you end up with some of the same issues that you get with coccidia. The puppies very frequently reinfect themselves with this condition. We can also see some resistant giardia infections, especially down here in the south, where instead of just using one medication, we have to do 2 or 3 medications. We have to double it up. We have to treat more than once because of certain resistant species. Now, one of the reasons we care about giardia is it can be transmitted to humans as well. It can cause a lot of the same vomiting and diarrhea issues in humans as it does in cats and dogs. Now, it's not easy to see an adult giardia or what are called giardia cysts on a fecal exam. A lot of the times you will have to do a send-out test, or there is even an in-house SNAP test. Now, the reason the SNAP test is not the best is after the infection is cleared, that SNAP test can still show up positive for a little bit of time and them not be actively infected. So it's kind of good to find original infections, not great to find later infections afterwards or to evaluate for resistant or persistent infections. Now, unfortunately, with the boom of doodles and French bulldogs, we are seeing significantly more giardia than we used to. It is very persistent in some of these breeds and persistent in some kennels that are kind of overpopulated and maybe have issues with cleanliness, or they're in an area that has a lot of rain and the rain runs off into the kennel or whatever. But because of that, we have seen more giardia and more resistant giardia in the past couple of years. So if you have an animal that's having diarrhea, get them evaluated early, and if you have a negative fecal, ask for the more in-depth fecal early so that hopefully we can reduce the number of these persistent or resistant infections we're starting to see.